Welcome to Science, Health and Healing Library of Children's Health Core. I'm Dr. Majid Ali. The subject of this article is Childhood Diabetes Type 2 Reversed. Childhood Type 2 Diabetes Reversed. This is the case of a teenager who had a grayish-green discoloration of her skin. She gained some weight. She had some mood problems, underactive thyroid. The blood test showed that she had mold allergy and food allergies. And she suffered from fatigue and muscle pain. I will first give you her insulin values, and then I will tell you what was the follow-up. She was prescribed metformin, a diabetes drug, by her pediatrician. Her peak insulin, her fasting insulin was 25. Many healthy people have fasting insulin value of less than 2 units. So she has at least 12 and a half times as much insulin fasting as many healthy adults who do not have any sign of laboratory or clinical sign of diabetes. At a half an hour, her peak insulin was 216. Most healthy adults have a peak insulin of less than 25 in an insulin profile done over a period of 3 hours. Many people have less than 20 units. So she has at least 10 times as much insulin at 30 minutes as many adults who are in good health. At 1 hour, her insulin was 195. At 2 hours, it was 209. And at 3 hours, her insulin still was 25 units. This teenager is severely insulin toxic. No wonder that she was gaining weight. No wonder that she had mood swings. No wonder that she had pigmentation of the skin. If her mother and her father and she herself had not been motivated and they did not fully understand the problem that she is insulin toxic and insulin toxicity is reversible. See, when you call it type 2 diabetes to someone and the teenager, the treatment is going to be metformin. A recent study published in 2012 showed that 50% of these children will need daily injections of insulin within 3 to 4 years. Let me emphasize the importance of this statement. Most adults with diabetes type 2 will not need daily insulin injections for 20, 30 or more years. So insulin type 2 diabetes in children is a very aggressive disease. There is a video article entitled, "Why is type 2 diabetes, childhood type 2 diabetes more aggressive?" That's part of this channel that you're watching. Please watch other programs, especially the two programs, Childhood Pre-Diabetes and Childhood Pre-Diabetes, a case study. You need to understand this. This teenager, we controlled her insulin, relieved her of her insulin toxic status by a diet program, and for that you can go to a website about a YouTube segment entitled Dr. Ali's Insulin Reduction Program. Please watch that. While you're at it, may I also suggest, please, if you're a parent of a teenager or a child who is diagnosed with type 2 childhood diabetes, please watch the segment 7 Stages of Insulin Toxicity. From my standpoint, this is as important as the child's grades. Because if you don't correct that problem, the probability is overwhelming that your straight A child is going to become B or C child. It's really that simple. So using Dr. Ali's insulin reduction program, using Dr. Ali's anti-gut fermentation protocol, there's a YouTube segment on that. Almost everything that every term that I'm using in this segment, there are separate YouTube segments devoted to this subject. I'm not interested in dumbing down the viewers of this encyclopedia, just like New York Times is. You think this is an unfair criticism? Show me an article in New York Times which ever said that type 2 diabetes in childhood is reversible. Show me an article in New York Times which said that type 2 diabetes is a problem of insulin toxicity. Show me an article in New York Times which says that childhood prediabetes is an insulin sickness. The reason for that is really simple, and you know that. All the money isn't talking about sugar. What teenagers like this case need is somebody to explain to them that their insulin is not working because insulin receptor protein embedded in the cell membrane is not working. The insulin receptor protein embedded in the fluid cell membrane is not working because the cell membranes have been plasticized, hardened by grease. The grease builds because of accumulation of excessive cellular debris, waste, rancid fats, sticky sugars, and tangled proteins. That is basically, in simple words, my oxygen model of type 2 diabetes, which I published 15 years ago. You can get the full article without any cost from wiki-medical.org, but I'm also going to post it on kids123.org, the official website of Children's Health Corps. This is a nonprofit foundation that my wife and I founded some years ago. Our vision is to disseminate authentic information free of cost about problems of toxicities of foods and thoughts and environments of children by reaching the children also as we try to reach their teachers and their parents and the community leaders. As long as the hundreds of billions of dollars of tax money goes to the National Institute of Health, Institute of Medicine, CDC, they are not interested in focusing on insulin. Nobody is giving them money for this. So the responsibility for your child, your teenager's health and grades at school, education, rests with you, the grandmother of that child, the grandfather of that child, the aunt of that child, the uncle of that child, mom, dad, teacher. If our vision resonates with you, Talat, my wife and I ask you to forward this YouTube segment to your email, Facebook, Twitter, LinkedIn, and other media contacts. Should you wish to support us more, send me an email, aliacademy7@gmail.com. Tell us your creative ideas, how you can contribute to our effort at Children's Health Corps. Until we meet again, may you be gracious, graceful, and generous in your spirit. Thank you for joining me. Thank you so much.